Welcome to our video on teratogenesis, or as I like to call it, embryology gone wrong. We're going to discuss teratogenic drugs first, and then some environmental exposures that can be teratogenic, and then finally we'll talk about some genetic things that can cause various congenital malformations. Now, in the last video, I mentioned that there's a period of development in which the baby is most susceptible to teratogens. Remember what that was? It's the embryonic period, which is weeks 3 through 8 of development. And why is this such a bad time for an embryo to be exposed to teratogens? What's going on during this time frame that's so crucial? Organogenesis. If you damage a developing organ or prevent it from developing normally, that's more likely to cause congenital defects. So let's start with some teratogenic drugs. Take a look at your study guide. Now, this isn't meant to be a complete list, but it's a good start. The first one is ACE inhibitors and ARBs, which can cause renal failure and oligohydramnios. Now, we use these drugs to protect the kidneys in diabetic patients, so it's kind of easy to remember that they can cause renal damage in the fetus. There are also 3 big classes of antibiotics that you should know about. Aminoglycosides like gentamicin can cause ototoxicity and cranial nerve 8 damage. Fluoroquinolones like ciprofloxacin or levofloxacin have a theoretical risk of causing cartilage damage in the fetus and also in children, based on animal studies. So generally we try to avoid quinolones in pregnancy, although there really isn't good definitive data that these actually cause any problems in humans. And then the third group of antibiotics is the tetracyclines, like tetracycline and doxycycline, which can cause discolored teeth in kids. So in general, we don't give tetracycline to children for that reason, and this could also happen in utero as well. Another group of drugs that in general are potentially dangerous are cancer drugs. Cancer drugs obviously interfere with rapidly dividing cells, so that's a bad thing if you're an embryo that's trying to make organs. Cyclophosphamide and other alkylating agents can be particularly teratogenic. They can cause ear and facial anomalies, limb hypoplasia, and the absence of digits. They're obviously going to interfere with rapidly growing cells. And then another cancer drug that's noteworthy for being teratogenic is methotrexate, which is a drug that works by interfering with folate metabolism, and that can lead to neural tube defects. We'll see that again in neuro when we talk about the development of the CNS and neural tube defects like spina bifida. But the reason that we give pregnant women prenatal vitamins that contain large doses of folic acid is to prevent these neural tube defects. So lock those two things together in your mind, neural tube defects and folic acid. And then one of the approved uses of methotrexate is to terminate an ectopic pregnancy. So obviously you don't want to give that to a pregnant woman who's trying to stay pregnant. And you're probably inclined to say, gosh, if you're getting chemotherapy for cancer while you're pregnant, that's a pretty bad deal no matter what, which is true. But I just want to point out that both of these drugs, cyclophosphamide and methotrexate, aren't just used for cancer. They're also used to treat inflammatory diseases like lupus and psoriasis and rheumatoid arthritis. So even though I've grouped these together as cancer drugs, it's not the only time you might see these used. The next few drugs on our list are seizure drugs. Both carbamazepine and valproic acid are known for causing neural tube defects, just like methotrexate. So if you have a patient with a history of seizures that's on one of these drugs, you want to make sure she's getting that folic acid supplement for at least a couple of months before she starts trying to get pregnant. And if possible, you want to get her off the seizure drug. Sometimes you just can't. Now, we used to recommend giving extra high doses of folic acid to these women. That's never actually been proven to be beneficial. And then the other seizure drug to mention is phenytoin, which can cause something called fetal hydantoin syndrome. Now, that's going to be covered in the neuro section when we talk about seizures and seizure drugs. Lithium is used as a mood stabilizer in patients with bipolar disorder, but it can cause a cardiac malformation called an Ebstein anomaly. We're going to talk about that in the cardiology section. Atorvastatin and other statin cholesterol drugs are basically contraindicated in pregnancy because they interfere with cholesterol synthesis, which is a really important process for making steroid hormones and other things that a developing fetus needs. So there's a possible increased risk of CNS and limb abnormalities. Another medication you should know about is warfarin, which can primarily cause bone and cartilage problems in the fetus, especially in the epiphyses. It can also cause nasal hypoplasia or hypoplasia of the nose, which is kind of unusual. Now, which anticoagulant is considered safe during pregnancy? Heparin, so be sure you know that one. Isotretinoin is a retinoid, a vitamin A derivative. Vitamin A is retinoic acid, right? Well, isotretinoin is contraindicated in pregnancy because it causes lots of spontaneous abortions and a fair number of birth defects like skull and CNS problems, heart problems, and parathyroid gland problems. There's a classic teratogen called diethylstilbestrol, or DES. It's so bad it was actually taken off the market. Children that are exposed to DES in utero are at a high risk of developing clear cell adenocarcinoma of the vagina much later in life, often in their teens and 20s, but sometimes as early as 7 or 8. And then the other classic teratogen that nobody uses anymore is thalidomide. Thalidomide was a sedative that was given to pregnant women 50 or 60 years ago until it was found to cause limb deformities called phocomelia, where you have severe hypoplasia of the arms and or the legs. Now, thalidomide can be used to treat Hansen disease or leprosy, but when was the last time you saw a patient with leprosy? Not very often. It's also sometimes used to treat multiple myeloma, but multiple myeloma is usually a disease of older people, well past childbearing age. Now let's go over some other types of teratogens besides drugs. Now, some of these are kind of hard to avoid, but they're worth knowing for your test. Ionizing radiation, like X-rays and CT scans, can cause CNS malformations if the exposure occurs early in pregnancy, and they can cause an increased risk of cancer, especially leukemias, later in pregnancy. We generally try to avoid X-rays in pregnancy, but sometimes you need them, you just can't avoid them at all. Now, excessive amounts of vitamin A can be teratogenic, just like we said with the vitamin A derivative, isotretinoin. Vitamin A in excess causes spontaneous abortions, causes microcephaly, can also cause cardiac defects. And excess vitamin A can also interfere with the migration of neural crest cells, and it can interfere with the homeobox gene or Hox gene expression. We're going to talk about Hox genes and what they do in just a moment. Maternal diabetes can cause all sorts of problems like cardiac defects and neural tube defects. It can also cause something called caudal regression syndrome, where the sacrum fails to develop normally. Now, we're not talking about gestational diabetes because that happens way after the embryonic period and way after organogenesis has already taken place. We're talking about women with pre-existing diabetes who then become pregnant. Along the same lines, maternal iodine deficiency can cause the baby to be born with congenital hypothyroidism, which we call cretinism. Now, in this case, it's not the iodine that's teratogenic, it's the iodine deficiency that causes problems. Likewise, nicotine and cocaine aren't necessarily teratogens per se. They don't really interfere with organogenesis, but they can lead to placental abruption, and they can also lead to low birth weight and intrauterine growth restriction because they interfere with the blood flow to the fetus. And there can also potentially be some neonatal addiction to these substances and some withdrawal symptoms within the first few hours to days of life. But alcohol, on the other hand, is a major cause of birth defects. So let's talk about fetal alcohol syndrome for a moment. Excessive alcohol consumption, either binge drinking or lots of drinks on a daily basis, can be harmful. But we really don't know what a safe amount of alcohol to consume during pregnancy would be, so the Surgeon General recommends no alcohol at all during pregnancy. So what do you get with fetal alcohol syndrome? There's some characteristic facial abnormalities with fetal alcohol syndrome, which include narrow eye openings and wide-set eyes, a smooth philtrum, and a thin upper lip. And alcohol can also cause cleft lip and cleft palate, so lots of midline facial abnormalities. Fetal alcohol syndrome is also a major cause of intellectual disability, which used to be called mental retardation. And along with that, you have microcephaly, and you can also see something called holoprosencephaly. Now, holoprosencephaly is where the hemispheres of the brain fail to separate across the midline, and it's often associated with facial anomalies where the facial structures fail to separate, so you can get a single midline eye. So again, it's another kind of midline facial deformity. So those are all the teratogenic drugs and exposures that we're going to cover. Now, I know it's a lot of material, so let's go to the whiteboard and review these in a slightly different format. All right, I want you to take out a piece of paper and write down these 7 different anomalies that I've listed over here on the left, and then we're going to try to match them to the various teratogenic drugs that I've listed on the right. Now, don't get lazy and just watch me do it. It's really helpful to go through the effort to write these down because it's going to force you to process this stuff using a different part of your brain. So the first one, we have cartilage damage. That's caused by levofloxacin potentially. Remember, fluoroquinolones hurt the bones. Discolored teeth can be seen with tetracyclines. Epstein anomaly, that's a cardiac anomaly where the tricuspid valve is displaced downward into the right ventricle so that the right ventricle is hypoplastic and the right atrium is abnormally large. We said that's associated with the use of lithium. Holoprosencephaly, remember that's where the brain hemispheres don't separate properly. We said that can be associated with maternal ethanol use. Limb hypoplasia, now lots of things can cause limb hypoplasia, but we mentioned it specifically with thalidomide and also with cyclophosphamide. Then spina bifida, remember spina bifida is a neural tube defect.
We said that when you hear neural tube defect, I want you to think folate deficiency. But the drugs listed here that also cause neural tube defects are the two anti-epileptics, carbamazepine and valproic acid. And then the last one here is ototoxicity, which is due to aminoglycosides. And the only aminoglycoside we have listed here is gentamicin. So be sure you can recognize these drugs as teratogens and then know the problems that they're most likely to cause. And as a little treat for you today, I have a gold star.
We're going to wrap up this video by talking about several genes that are crucial for normal embryogenesis and how mutations in these genes can lead to congenital anomalies. I just want to highlight a couple of the more testable ones. The first genes I want to mention are the homeobox genes, or the HOX genes. There's a short section on the HOX genes in your study guide. Homeobox genes are the blueprints for skeletal morphology. They code for transcription regulators, so these gene products regulate the expression and transcription of other genes. Basically, HOX genes make sure that the skeleton is laid out correctly, so you don't have arms and legs in the wrong places. There are some experimental models in which they've altered the HOX genes in fruit flies and they end up growing legs on their heads where the antenna should be, or they grow an extra set of wings, that sort of thing. Now in humans, mutation of the specific homeobox gene HOXD13 causes something called synpolydactyly. Poly is many or multiple, and then dactyly has to do with the digits. So polydactyly is when you have more than the normal number of digits on a hand, kind of like the six-fingered man in The Princess Bride. But then syn means together, so syndactyly is where you have fusion of the fingers. So with this HOXD13 mutation, you have synpolydactyly, so there are extra digits and they're fused together. And we've already mentioned that excess vitamin A, or retinoic acid as a derivative of vitamin A, can alter HOX gene expression. So again, we don't give vitamin A supplements to pregnant women. The next gene to discuss is the sonic hedgehog gene. So there's a family of genes that was first discovered in fruit flies, and for whatever reason they were named hedgehog genes. And then somebody got cute and named one of the genes Sonic Hedgehog, like the video game character. There's also a cancer-causing gene that they named Pokemon until Nintendo threatened to sue. True story. But this sonic hedgehog gene is expressed at the buds of the limbs in a zone called the ZPA, or the zone of polarizing activity. And kind of like the HOX genes, the sonic hedgehog gene is involved in organizing the layout of the embryo in an anterior to posterior direction, setting up which pole is going to become the head and which pole is going to become the tail, and then organizing all the points in between. So one thing you need to know is that mutations of sonic hedgehog can cause holoprosencephaly, where the hemispheres of the brain fail to separate across the midline, and then again, in severe cases, you have that single midline eye. Now, where did we see that earlier? Fetal alcohol syndrome can also potentially cause this. So the sonic hedgehog gene is important for organizing the embryo along the anterior-posterior axis in the cranial-caudal direction. There's another gene called WNT7, which is important for organizing the embryo in the dorsal ventral axis so that your feet and your nose are pointing in the same direction. One student suggested that the NT in WNT7 can remind you that this gene controls the direction of the nose and the toes. And there's a gene called FGF that's important for limb lengthening. So FGF is fibroblast growth factor. So if you have a defect of this FGF gene, you're going to have short limbs. And actually, a mutation in the gene for the FGF receptor 3 causes achondroplasia, which results in, you guessed it, short limbs. All right, that's it for our video on teratogens. So go ahead and pause the video, answer the end of session quiz questions on your own, and then we'll go through the answers together. Let's go over the answer to the end of session quiz. First question, which antibiotics are potentially teratogenic? So we mentioned the aminoglycosides, the tetracyclines, which cause discolored teeth, and the fluoroquinolones, which can potentially cause cartilage abnormalities. Next, a pregnant woman is diagnosed with a DVT of the left leg. Which anticoagulant is contraindicated during pregnancy? Well, that's warfarin. And which anticoagulant is preferred? That's heparin. And the last question, examination of a fetus from a spontaneous abortion at 14 weeks gestation reveals a vestigial pair of legs that arise from the torso just below the arms. A mutation in what family of genes is the most likely cause of this malformation? Well, this is, again, the homeobox or HOX genes. Remember, HOX genes determine the layout of the appendages. So that's the end of the end of session quiz, but just below that, you see this table called Rapid Fire Facts. We've identified almost 300 of the highest yield factoids and high yield associations, most common causes, buzzwords basically. A lot of people try to tell you that step 1 doesn't test buzzwords, but honestly, if you know the buzzwords, it's going to save you some time in coming to the right diagnosis when you read the question, so that then you can answer whatever the question is actually asking about pathophysiology or whatever. So in some of our videos, after the end of session quiz, we're going to have a handful of these rapid fire facts for you to jot down. Then later you can flip through these and cover up one side and kind of quiz yourself, or get a study partner and take turns quizzing each other. So these are great to go through at the end of the course, maybe on the last day or so before your exam. So let's go through these rapid fire facts. The most common cause of neural tube defects is folate deficiency. And the most common preventable cause of congenital malformations in the U.S. is alcohol use during pregnancy. All right, that's it for this video. I'll see you next time.